The number of swine flu patients is on the rise. According to the World Health Organization, this number may further increase in the coming days. The virus has been detected in some Arab states. In Pakistan, the NWFP is highly vulnerable to the deadly disease, since a large number of overseas Pakistanis in countries like Saudi Arabia, the United Arab Emirates, and other Gulf states are from this province. The government has put in place a special surveillance system at different airports and along the Pak-Afghan border. But it will not be easy to keep the virus from spreading if it enters the region. One of the swine flu cases being treated at a hospital in Islamabad is also from the NWFP. Regrettably, the province lacks facilities to handle the situation.
We are not fully prepared for it, though primarily setup has been created here in KTH as well, but still the arrangements are very much deficient, and we need to prepare all the healthcare workers as well as the general public how to deal with it.
According to the paramedics, they don't know much about the virus. They point out that it would be difficult for them to take care of the patients in case of pandemic in the area.
बर्ड फ्लू के बारे में या स्वाइन फ्लू के बारे में या डेंगू फीवर जब जिस तरह ये पेशेंट आ जाते हैं हमारे पास, तो कम से कम हमें ऐसी ट्रेनिंग देनी चाहिए कि हम खुद को तो बचाएं ना, जब हम खुद बच जाएं तो हम मरीजों को बचाएंगे, हम उसके अटेंडेंट्स को भी एजुकेट करेंगे। जब हमारे पास नॉलेज हो इसके बारे में तो हम उनको बताएंगे। जब हमें खुद पता नहीं होता है तो हम पेशेंट को किस तरह या उसके अटेंडेंट्स को किस तरह बताएंगे।
The Khyber Teaching Hospital is the only major hospital with a rudimentary quarantine facility. 2 bird flu patients died in this hospital in November 2007 due to lack of facilities. Yet the authorities have not taken necessary steps to improve the situation.
तो ये 3 कमरे हैं हमारे पास फिलहाल, और अगर खुदा न खास्ता पेशेंट ज़्यादा आ जाएं तो फिर हम कहीं ऑक्यूपाई नहीं कर सकेंगे, इसलिए अगर कोई और जगह भी वो कर लें इसके लिए स्पेशल तो अच्छा हो जाएगा, क्योंकि ये प्राइवेट रूम्स हैं।
But the question remains, is the NWFP government alive to the threat of the pandemic?
To make a specific ward, you need to have time. And for that matter, it takes time to build a room or build a ward and then operate it. So for that matter, if there need be, we will go for that. We have the sufficient funds at our own disposal. We can do that. So far, we are this threat is concerned. We are aware of it and we are ready for that thing.
The government is yet to take steps and build new wards. Meanwhile, experts fear about a possible outbreak of these pandemics, pointing to the fact that the government is not prepared to handle the situation. It appears that the government is not prepared to face the situation in case of any outbreak. Only 3 rooms have been converted into an isolation ward here at Khyber Teaching Hospital, which is not sufficient to cater to the needs of the entire province. Mumtaz Bangash, Dawn News, Peshawar.